Cath, do you just want to give us a preview of like the next few stages in this process that Wes Streeting and Keir Starmer have started today?
Well, there's sort of some quick fixes, the thousands of extra appointments happening each week, and they're trying to get waiting lists down, which isn't happening yet. But really, the next big step is going to be spring when we hear what this 10-year plan is. And in between autumn and spring is winter, which we all know is an absolute nightmare for the NHS at the best of times, which we're not in right now.
The other thing I spotted today that's related to this is a report from the Office of Budget Responsibility. And they every year do this thing called the fiscal risks, where they look at just what's going to happen to the public finances in 10 years, 20 years, 50 years. And they say in 50 years' time, at the current rate, the amount we'll be spending on health as a percentage of GDP, of the economy overall, will double from 7% to 14%. And as a result, if you include that and the climate change, whether it's the cost of a changing climate or the cost of getting to net zero, which is the government's policy,
doesn't leave a lot of money.
The debt to GDP, which is currently about 98%, so government debt compared to the size of the whole economy will go from 98% to 300%.
So, there's some important stuff in this report. One which says we expected improvements in medical technology and healthcare, etc., and improvements in the wealth of the population to lead to a healthier population. And we've actually not seen that happen. That's important, isn't it? Because what you have is a sicker working age population and children who are less healthy than they used to be. If we're serious about the NHS as a whole, not just hospitals becoming part of this, what you need is a healthcare system that helps children and working age adults live healthier lives, be more productive and more effective, supports people to be in employment, etc. At the minute, lots of my hospital is dedicated to the support and care of people in the last couple of years of their life. Frail elderly people who are struggling because care home provision is not necessarily where it could be. They're struggling to get domiciliary care support, community teams, etc., because the money's been pulled out of that or it's been moved into the private sector where the provision is different. You try and get a dementia bed now, you pay a huge premium for someone to go into a care home if they've got dementia, so they end up in our hospital stuck with us, And it's bad for the patient, it's bad for their family, and it's difficult for us. So the stuff in this report about the policy shifts needed, there's some pretty big, brave policy shifts, but there's also that conversation about how do you make the NHS an engine for a healthier working age population in the UK.
It is really striking, though, that the stuff that's come out about children's health, children are waiting longer than adults. So we asked Lord Darzi, what shocked you? And that was what he picked out, the way that the children are being treated or not treated, they're not getting the help, and their mental health is struggling. It was really striking to me that was the thing that it was kind of the shocked him.
That is very upsetting. And actually the people who wait the very, very longest in our emergency department tend to be people with mental health problems. So coming in here today, we've got 10 people who've been in the department for more than 24 hours. 8 of those people are people who are under mental health trust. 2 of them are looked after children who are waiting for a placement. A woman who's been with us, I think, for over 400 hours now.
I was going to say, what's the longest?
Yeah, waiting for a placement.
I know of someone a young girl, 16, who, not in your trust, you'll be pleased to know, but was in hospital in A&E for 2 weeks. I mean, that's a kind of...
What, so just in one of those beds with the curtain around you?
Like in a kind of off room from A&E, but they couldn't get her admitted anywhere.
It's really complicated and difficult stuff usually. I mean, one of the things that
it is complex.
It is complex, and some of the children have got very challenging behaviour, and it's really heartbreaking to see quite how distressing some of these cases are. The private market for children's specialist placements, by the way, is insane. The prices that are charged there are off the charts. And if you got someone from a local authority and ask them where their biggest cost pressures are, they will talk about some of those cases as being incredibly difficult. And it is really difficult because the A&E sometimes ends up as the last place that's open 24 hours a day with clinical supervision for that. But I think what this report is saying is about the health of the nation as general has been compromised. And what we've ended up with is a situation where we're spending a lot of money in the kind of acute end of things when care tends to be most expensive and you don't necessarily get the best returns.
Yeah.
And that is the shift that this report, I think, is highlighting for the plan that's going to come out next year.
Weirdly, what you're saying, Matthew, is reminding me of an episode we did earlier this week about prisons, and we heard a clip of a guy who'd just been released from Doncaster prison, and he said he hoped he'd get back quite soon because he didn't have anywhere else to live. And so actually the picture you've painted of an emergency department actually sounds quite similar to like what that guy was saying about the prison he'd just come out of.
Well, anyone who's been into an A&E recently on a busy evening will have seen that in amongst the people who are in there with broken arms or burns or skulls. There's people who are experiencing really complicated situations in their life. People are really profoundly distressed. People are having problems with drugs and alcohol. I spoke to a woman last week whose 88-year-old dad, a week ago, he was, we had to look after him in a corridor overnight, and I went for a chat with her because she emailed me and I went down to find her. And she emailed me the day after to say, we're on a ward now, it's much better. And one of the things she said was she was shocked by some of the people who were in the emergency department. She was just shocked to see that actually the staff were having to look after her dad, but also to look after someone who had clearly taken far too many drugs and was really, really struggling. They were working with the mental health liaison team. I was in A&E this morning, and we had 6 security in one corner next to 2 mental health patients who were in there. They're entitled to come into A&E, and they need our help and they need our compassion and our care. But the better way to support people like that is to give them access to community services, is to help them before they become ill enough that they come to us.
Stop the crisis happening.
Exactly that.
And there we shall leave it. Matthew, thank you very much.
Thank you very much.
And Cath, thanks to you too.
Thank you.
Newscast from the BBC.